So now that we've established through the subjective interview that the patient is alert and oriented times 3, we're going to move forward with the objective neuro exam. First, we're going to inspect the patency of the nostrils, looking at cranial nerve number 1, the olfactory. We're going to make sure that the patency is unobstructed bilaterally. If there were any issues during the subjective interview that led me to believe there were issues with smell, I would then place an aromatic substance under each of the nostrils to determine if she could identify them. Moving on to cranial nerve 2, the optic nerve, we're going to start with our ophthalmoscope looking at the fundus, the ocular fundus. So here I'm examining the ocular fundus. There's no pallor, papilledema, or cup enlargement noted. Next, we're going to use a Snellen chart to assess for visual acuity. L-D-P-O. So here I'm inspecting the pupils. They're equal, round, and reactive to light. And next, I'll be testing for accommodation. Now we're moving on to cranial nerve 5, the trigeminal nerve. So I'm going to have you clench your jaw. Any pain with that? No. Okay. And then I'll have you open your mouth and move your jaw left and right. Does that feel okay? Mm-hmm. Now we're going to look at the facial nerve, which is cranial nerve 7. Okay, I'll have you put your face in a couple of different expressions for me, okay? Just as natural as you can. First, can you start with a big smile? Right, and a frown? Cranial nerve 7 innervates all muscles of facial movement and expression. Here I'm looking to see that the muscles move easy and symmetrical. Moving on to the acoustic nerve, which is cranial nerve 8. I'm going to do what's called a whisper test. So I'm going to block the sound of one ear. I'm going to whisper 3 letters or numbers, and I'll have you repeat those back to me.
5-8K. A7-11.
Now we're going to look at cranial nerves 9 and 10, the glossopharyngeal and the vagus. Can I have you open your mouth for me? Say ah. Ah. Here I'm observing the pharynx. The soft palate should rise promptly and symmetrically. The uvula should remain midline. Each side of the posterior phalanx moves medially like a curtain bilaterally. So now we're going to observe the sternomastoid muscle, looking at the spinal accessory nerve number 11. So what I'm going to do is place my hands on your shoulders, and I'll have you shrug your shoulders. And then I'm going to put my hand on your cheek, and I'll have you push against it. You'll want to note here whether the sternomastoid and trapezius are equal in size and strength, and that there is no atrophy or weakness present. We're looking at cranial nerve 12, the hypoglossal. The hypoglossal cranial nerve mediates tongue motor function and affects articulation of words. You'll want to note the tongue's symmetry and or any deviation from the midline. Can you say light, tight, dynamite?
Light, tight, dynamite.
Here we're going to inspect and palpate the motor system. We're going to compare left to right side for the muscle groups and ensure that they are normal size for age and symmetric bilaterally. Okay. Now we're going to look at strength of your muscles. So I'm going to have you bend your elbows like this and pull against me. For the strength assessment, we're looking to see that there's active movement with full resistance and no fatigue. Now I'm going to look at tone, starting with the fingers, the wrist. Note if there's a mild even resistance to all extremities bilaterally and no involuntary movements. Other side. Next, we're going to take a look at cerebellar function, starting with hands on your knees. And I'll have you pat your knees. Flip your hands over. Now go back and forth. For cerebellar function, we're looking to see that the movements are equal and symmetric. I'm going to take your hand, open it up, and you're we're inspecting the gait. After inspecting the gait, we will look at tandem walking. This is the Romberg test. I'm going to have you stand with your feet together, hands by your side. Now, I'd like you to close your eyes for 20 seconds. I'm inspecting for any swaying here. Hop in place on one leg and the other. Now we're going to be looking at the sensory of pain perception, starting with sharp or dull. So I have you open your foot and tell me the sensation that you feel, whether it's sharp or dull.
Sharp. Dull. Sharp. Dull.
Continuing on with the sensory, we're going to test the sensation of light touch. So I have a cotton ball. I'm going to touch different areas of your body, and when you feel the sensation, just say yes. Okay. Can you close your eyes, please?
Yes. 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 Yes.
We're looking at the posterior dorsal column for vibration and sensory. So I'm going to place the tuning fork on your finger, and I'll have you tell me when the vibration starts and stops. Okay? So,
Start. Stop. Start. Stop.
okay, and put your foot in my lap.
Start. Stop.
Another one.
Start. Stop.
Okay. We'll be looking at position sense in this next exam. Okay, I'll take your hand. So when I have you close your eyes, I'll have you identify whether I'm moving your finger up and down or left and right. Does that make sense? Okay, close your eyes, please.
Up and down. Left and right. Up and down. Left and right.
Okay, so testing the quadriceps or patellar reflex, you want to make sure that the knees are dangling. Okay, and just relax your legs.
That was my actual reflex.
I know.
Just went.
So now we're going to finish up the deep tendon reflexes, starting with the biceps. Just relax your arm. And the triceps. All right, let me have your two thumbs. Just relax your arms. This is the brachioradialis. For the Achilles reflex, we're going to have the patient in a supine position. Please cross your ankle over your shin. Okay, and switch legs. So now we're looking at plantar flexion. Plantar flexion is noted bilaterally.